Welcome to this fifth edition of the Lightbeam Voices of Value podcast on LinkedIn Live in our now familiar podcast format. It is indeed a pleasure for me to welcome Lightbeam's Chief Technology Officer and my colleague Mike Hoxter as our guest of honor to this podcast. Mike and I share a huge passion for AI innovation in healthcare. By way of a quick introduction, Mike is an industrial engineer from the University of San Diego, one of the co-founders and the chief technology officer at Lightbeam Health since inception, and is spearheading Lightbeam's efforts on AI innovation with Evan Huang, who you've heard on the previous podcast. He has been instrumental in driving innovation and strategic planning at Lightbeam Health Solutions since 2013, where he leverages his expertise in healthcare analytics and information technology to drive meaningful outcomes for our customers and for our patients. Mike, welcome to the Voices of Value. Let us get started without further ado.
Okay. Thank you so much for having me, Andy. Glad to be here.
Awesome. So first question for you. I know these are amazing conversations you and I often have. What is the fundamental value proposition for embracing AI relative to the human brain, which one would argue is also a significant and a very powerful computer?
Yeah, I mean, sky's the limit as far as what you can do with this. I've been using AI pretty heavily for a couple of years now. I mean, we've been using AI technologies for over a decade. Pre-Gen AI days with a lot of kind of machine learning type technology. So we're definitely this is not our first rodeo when it comes to AI types of technologies. But as far as what it can do, there's so many things. And I think one of the biggest improvements over any of the existing technologies, kind of the intent, the ability to understand intent of natural language, has taken such a massive jump from anything that we've ever had previously. And so there's a lot of communication that happens that is not natural language today, right? Mm-hmm. There's a lot of documentation. There's a ton of tasks. And so generative AI specifically is a fantastic translator. And so a lot of these documents, these needs that we have as a technology organization, as healthcare providers, as any of these things, really comes down to the human brain being able to talk to a person, understand the intent of that person, and then do the thing that they want us to do. And so like the ability for a computer to actually understand that intent and take it and reformat that to a form, a document, code for software. It's just excellent being able to let you think about what you want, not necessarily the proper formatting of what you want or the proper syntax of what you want, which is kind of a lot of what you spend your brain, a lot of the time that your brain spends tackling a problem is not necessarily figuring out the way you want to solve it, but like the nitty gritty detail of on the software side, the proper syntax, right? That's a massive amount of kind of CPU cycles of your brain that can kind of get translated by AI these days. So the fundamental proposition is really that, just like understanding what people want, translating that to the next step, be that a software solution or what is the report that you're looking for, what is the what is it that you want, and understanding that, kind of getting you to the right place. There's ton of applications for that.
Awesome. So you've heard me talk about kind of this notion of a portfolio management approach to AI in healthcare, because clearly it's a portfolio of multiple technologies, more mature technologies like machine learning, natural language processing, natural language generations, to recent technologies like Gen AI and LLMs, and then emergent technologies like agentic AI, AI agents, and even medical robotics, which doesn't conventionally get talked about. So what is your perspective? I mean, if you talk to a lot of people, they're obviously influenced by the huge hype around Gen AI and LLMs, which interestingly enough is already reached the trough of disillusionment of the Gartner hype cycle, and the MIT report saying 95% of a lot of the Gen AI investments have not seen value. So what is your perspective on what is AI in healthcare. Is AI in healthcare really a hybrid of all of these technologies to, again, deliver value and outcomes for our customers?
I mean, I think a hybrid is a really good way to put it. There's a ton that can be done. I think there is certainly misset expectations by a lot of people for what AI in general, Gen AI or machine learning can do. Yeah, I've heard people talk about giving LLMs a large amount of healthcare data and having it do analytics on that. That's just not what it's for.
Mm-hmm.
It's not math. It's not doing math. They're probabilistic, right? It's oversimplification, but somewhat of a dice roll every time you use a large language model to do something, which doesn't make it useless, but it does limit the applications that it's useful for. I think properly understanding what it should be used for, how it can be used for, and knowing what to do and knowing what not to do with the right tool in the tool chest, I think is very, very important. And
Exactly.
I think that's probably one of the biggest things when it comes to, I saw the study that you're talking about, the MIT 95% of kind of projects fail. I think we're still kind of in this phase of adopting this technology where we're figuring out what it can do, and we're figuring out what it is useful for and what it is not useful for. And I think when you're trying to figure it out, you throw a lot of stuff against the wall and not all of it sticks. And that's not an indictment of AI being bad. I think we would like it to do a lot of things that maybe it's not ready for yet.
Yeah.
And so that I think there's been a lot of those cases where you, especially if you use one of the older models where hallucinations were much more prevalent. Hallucinations in a healthcare setting precludes you from a vast amount of the use cases which it would be great for. A hallucination from a large language model, and that being in patient care sort of settings, is completely unacceptable.
Exactly.
Right. So you can't use Gen AI for everything. You can't, humans are super important still. I do not think that we're even close to where like LLMs completely replace humans. They're very myopic in their view of what they're looking at. They don't look at the big picture. And so we absolutely need humans involved to use these things as tools to be more efficient, to work at the top of their license as practitioners. We can use it to automate a lot of the paperwork, the repetitive administrative tasks. We spend a lot of our doctor and nurse hours worrying about things that is not what a doctor and nurse should be worried about. We want our doctors and our nurses taking care of patients. We don't really want them spending all their time doing paperwork, making sure that the codes are right, there's all of these sort of administrative overhead tasks that we have very, very valuable resources doing, that we shouldn't need them to do those things. And so I think those are like the primary use cases where we can make really, really big impacts on kind of the day-to-day life of providers in the system. When it comes to the data side of things, there are very mature tools for this. So there, a lot of the machine learning, the deep learning, when we're looking at large data sets to really gather insights on that data, that is existing technology that at that use case is far superior to a large language model. Large language models are great for language, right? So it comes down to, you could use a large language model to understand the intent of what the user wanted, and then that could be used to then build out a machine learning model to actually do the math. But when what you're looking for is like a deterministic answer, so for us, a lot of that deterministic answer is a predictive score of a patient going to the hospital for a reason. I don't trust an LLM to come up with that score. I want to do math, right? I want numbers. I want repeatable, deterministic way to calculate those things, because that's extremely important, and a hallucination is completely unacceptable. So that there are AI tools that don't have that in the back end, what they're doing is very complex mathematics. So you're going to get a deterministic answer. And then on the medical robotics, I mean, I think there are a lot of use cases for this. with medical robotics, even with like manufacturing and things like this,
Yeah.
where there are a number of tasks where the AI systems are not even close to where a human's going to be. And I don't know with the current technology, without some really, really big breakthroughs, which will happen eventually, but we don't necessarily know when. There's a lot of tasks that under the current technology are never going to be replaced. Humans are never going to be replaced by technology. And those things are becoming more and more valuable because a human's the only thing that can do it. And so having the humans do those things is really just the best that we can do as a nation who's trying to take care of our patients, right? We want these very, very valuable resources of these doctor and nurse hours to be spent taking care of patients, and then those kind of tasks that are more administrative in nature. Ideally, we want to automate those away as much as we possibly can, and really get more patient to doctor face time.
Couldn't agree more. Gen AI LLMs are clearly not the hammer for every nail,
Yep.
which is why just as you manage a portfolio of technologies, including ERP, EMR, supply chain management, rev cycle management, population health management, so also pick the right tool for the right use case. Thank you
Absolutely.
for that.
Absolutely.
So quickly go to reference. I mean, Lightbeam obviously has been developing AI since 2013. You've been spearheading a lot of those efforts. We've seen this slide before, so it kind of lays out the timeline for how we acquired Javion. We went from traditional machine learning, deep learning models to now more Gen AI, agentic AI, etc. So based on this portfolio of technologies and what we have developed, where are you seeing the most excitement from our customers and prospects in healthcare? Because you obviously engage with a lot of them, when they come to us.
Sure. Yeah. So I mean, there's the most prevalent kind of highest adoption tools out there right now are kind of in the ambient listening space.
Mm-hmm.
A lot of them, the dictation side of things, having what is spoken then turn into actions where a human doesn't need to do that work, I think is a great example of one of those administrative tasks where we had this conversation, we talked about the things. It was quick, a lot of information spit out verbally, and that's not what our healthcare system needs for billing and administrative purposes. So I think that's a fantastic use case. I'm glad to see that the kind of adoption starting to take off for those tools. I think one of the things for us as a company, which is something that we've done for a long time, is kind of this. We've used these machine learning technologies to really generate insights, right? That's the purpose of them, is generating insights about patients. We've done population health for over a decade, identifying the patient population that has a need and getting that patient population, mm-hmm. whatever that need happens to be. Could be something on a very, very high risk use case, patients that are very sick with multiple comorbidities that are likely to go to the hospital, a high touch program for them. Also, lower use things, wellness visits, right? Medicare annual wellness visit is a huge value to the provider, to the to Medicare or the Medicare Advantage plan, and to the patient. It's a comprehensive visit that you can get those get a lot of stuff taken care of in that time. And so, I think there's all of these things are patient level. So we are generally limited, back to the doctor and nurse time, we're limited by resources. That's the healthcare system. That's just about every business, right? You want to do more than you have people to do it. So for us, we have a lot of this kind of insights to know who needs what. That's kind of existing functionality we've had in the system for a lot of years. What we have a lot of clients that are getting excited about are more on our care signal platform of the actual patient facing side of things, where we've had fairly again deterministic workflows to communicate with patients for not the highest risk care management cohort, but kind of the rising risk and medium risk cohorts who still need care. They still need checkups. We still need to make sure that they're getting their wellness visits, filling their medications, doing all the things that they need to do to take care of themselves. But they're not so high that we've dedicated a person to manually doing it. Those sort of things we can have a, you know, moderate to high touch care management type of workflow where we're taking much better care of patients than would be a, you know, you see your doctor once a year, here's your order, and you go about your day, and we just kind of hope for the best. We can follow up on these patients. We can provide them with a care management level of care that has historically only been reserved for the top 2 to 3% of any given population because of the number of people that are dedicated to that task. So having those sort of systems in place where the insights that we've always had become automated actions, and we can take better care of a patient population directly with those patients, make sure that they're getting in for their AWVs without a person needing to make sure that we're calling them and doing it, making sure they're refilling their medications without needing to pay a human to call and do it, right? So we start to remove some of those human resource limitations for a lot of those tasks, which really what that ends up with is just better care for a patient population. You can take better care of people by making sure that they're getting everything that they need. And so, you know, you don't want to do that for only 2 to 3% of your population. That's just been a limit that has generally been in place. Sometimes it's a little bit more, but you only have so many humans that you can put at that. And so that for AI is one of the things that I think is going to be a game changer.
Cool. That's a great segue into the next question. Obviously, this notion, I mean, the founder of Anthropic is talking about how software really will be written by AI agents, you know, going forward. And of course, at Lightbeam as well, as we are developing innovative, you know, Gen AI, LLM, agentic AI solutions for our customers, you've also been deploying AI from a development perspective. So without giving out names of platforms, etc., which obviously is sensitive, can you talk about some of the efficiencies, productivity, and ROI you are seeing from kind of this notion of eating your own dog food with AI from a development perspective?
I mean, absolutely. I mean, we've, you know, our first our first foray into using AI as a company was starting to eat our own dog food, right? To start to build internal tools. So some of those, we do use some commercial platforms for software development. For now, we have our kind of support. Anything that comes in through support is not. It's not. We still have humans that are talking to humans for support purposes, but the tools that we have given those humans allows them to increase throughput. And then we're in Microsoft Azure. So we have the full suite of OpenAI, Azure OpenAI tools, and the AI Foundry. They have an excellent framework for building tools. So we built a lot of internal tools to basically give to our own employees just to improve quality of life. You know, give them tools so that they can do the things that they need to do, and you know, keep moving forward. So kind of similar to what we want to see happen with the providers, right? Having everybody work to the top of their license. We want that for our own people too. You know, the high amount of administrative tasks is not limited to doctors and nurses. That's kind of business these days. So, you know, any of those sort of tasks that we can automate away is that's where we want to get.
Very interesting, right? I mean, Salesforce just laid off 4,000 people.
I saw that.
4,000 of the 9,000, I think, were in customer service. So kind of, you know, harbinger of things to come. You know, we have kind of the timeline laid out and some of the innovation that your team and Evan's team have been leading. So can you talk briefly about the overarching areas where Lightbeam is innovating with artificial intelligence to deliver value to its customers, as well as some of the specific use cases? Obviously, given the recent recognition, one of the first 10 Microsoft partners in healthcare to be recognized with the AI certification. I know you've been spearheading the efforts around the Dragon AI Copilot for, you know, cohorting. Is that something you can talk about and maybe even give us a little demo?
Sure. Yeah. We, you know, whenever we're going into any kind of system like this, you know, we really like to we really like to sanity check the direction that we're headed. We can get subject matter experts, both internally and externally, to make sure that the direction we're headed with the technology is the right one. We're not doing the wrong thing here. So we found that the kind of through our Azure partnership that there was a certification available for AI applications. We went for it with our kind of cohort co-pilot, and so yeah, I think we're in the first 10 to gain the Microsoft Partner certification for Azure, and I think that mainly speaks to just kind of the rigor that we hold ourselves to when it comes to just the platform in general. This is one of many kind of certifications that we hold. We make sure that our quality measures are HEDIS certified. We make sure we do our SOC 2. We're high trust certified on the security side of things, the safety of the data, and ensuring that we're doing things in a very, very safe and secure manner is job one for everybody here. Protecting our clients' data and making sure that this is done in a safe, well-architected framework that kind of make sure that we're scaling and make sure that we're doing things the way that are either certifiable in the case of like an NCQA HEDIS, or just make sure we're doing things the best possible way. Best, safest, better, faster, strong, right, every time we can. But yeah, let me go ahead and hop into the demo here, and I'll show you what the Copilot looks like. So within the cohort builder, this is very much the hub of kind of the hub and spoke for many different things that we do. There's a lot of data input, and there's a lot of things that we do. At the end of the day, you find a list of patients that need a thing, and you get that list of patients the thing that they need. That could be a care gap, that could be management of chronic conditions, that could be a number of different things. But the important part is that you can make very efficient operationalizing the process of identifying who needs something and getting that patient the thing that they need. So we built a while ago our cohort builder, and it's grown over time to include a lot of different domains of information. So just as an example, we're always going to start with demographics. What's the contract? Who are we looking at? Are we limiting it to active patients? But you can go and you can add in a variety of different domains of information. Procedures, diagnoses, medications, financial history, patients who cost a certain amount. We can go into admissions and have only patients who had some number of ER visits in the last X number of years or months. But you can get a very, very fine-tuned way of building a patient list, and then this runs on a nightly basis. And any new patients that pop into the list get added to the cohort, and whatever actions are configured automatically happen with that cohort. And so we have this, but it's a complex set of a lot of different criteria. And so what we seek to do was essentially make the users that want to digest and get a list a much easier way to do that. So we have this screen. This is where kind of your end user care manager would generally go and look up a cohort. So we have Johns Hopkins ACG. We can go and we can look up the high risk ACG. And this is demo data, but we can go look at this list of patients. And so we can create a list a number of ways using that cohort builder. So what we did is we added the cohort copilot down here. And what this is going to do is this has access to all the information within this environment. And it can kind of help to guide the user with getting that cohort that they're looking for much more easily and simply by kind of understanding everything that the user is meaning. We all have different nomenclatures, different things that we mean when we're talking. And like I was saying earlier, the natural language processing and kind of ability to understand intent is one of the biggest breakthroughs that kind of Gen AI has given us. So just as a quick demo, I'll keep it fairly simple. But if I wanted to look here at patients over 65 who have a risk score greater than 2 who don't have an appointment in the let's say the next 6 months. So little bit of ambiguity in there. I didn't leave it too much room, but what it's going to do is it's going to go out and it's going to kind of clarify for me the things that I needed. So for example, I'm talking about patients who are over 65. Do you mean as of today or as of January 1st of this year? Depending on your measurement program, depending on what you're trying to do, maybe one of those matters. Let's go ahead and do age as of today. What's the next score? So I said a risk score greater than 2. We have a bunch of risk scores. So there are a lot of different risk scores that could mean. Which one do you mean? And so for this one, I could do something like show me the risk scores and appointments. No past appointments in the last 6 months or for appointments in the future 6 months. So who don't have an appointment. So I'm basically looking for my high risk senior patient population that I don't already have an appointment with. So it understands what I'm talking about. It asks some follow-up questions. I have a number of different risk scores that are in here today. And so I'm going to say the Lightbeam ATI score. So the Lightbeam ATI score, which is going to be, we'll do the ability to impact score, but you could pick any one of the risk scores that you wanted. Mm-hmm. So I'll go ahead and specify that. And so it's gonna have a conversation with me. It's gonna confirm what I want. So it's confirming here patients who are currently over 65 who have an ATI greater than 2, no future appointments scheduled in the next 6 months. Is that correct? That's everything that I said. So that makes sense. It did clarify on the age. It clarified on the risk score. But I can do this with care gaps. I can do this with cost. So I'll just go ahead and tell it to proceed. And any of the criteria that I've given it, it's going to go and look up on the back end, kind of all of the lists and make sure that I've given it everything that it needs to have. Okay, and so we have that patient list that meets the criteria that I explained to the AI. It asked its clarifying questions, and it came back with saying 1,000 patients is actually exceeding the rows. We'll limit this screen to 1,000 patients, but now you have the list of patients that meets the criteria that you were talking about. You explained to the AI what you wanted, and it went and it got it for you. So then you now have the ability to then take action. So we have all the data that came in. We ran the cohort. You explained to the AI what you wanted, and then we can do anything that we want to do from there. Now that you've identified the patient population, kind of with the assistance of the Copilot, you can then enroll the patients in a care plan. You can assign them to a user. You can add a care plan to them. There's a number of things that you can do with this patient population now. You can run analytics on this subset of the population to see how they're doing versus the global average of the rest of the patients. You can do a variety of things, and all you really had to do to identify that patient population is explain to an AI what it was that you wanted. And so it then kind of helps to generate what has been a possible but kind of complex workflow, because there's just so many options. So the 10 different domains of information that we're looking across, you don't really need to understand all of those, because as they change and as we roll out different updates, the AI is going to get the updated documentation that's going to know for you. So we have a cohort here of exactly what we said. Patients over 65 with ATI risk score greater than 2 and no future appointments in 6 months. So now we have that patient population, and that used to be a fairly long process of getting it, and so now it's fast. We can start to take action, and that's really what it's all about. It's getting to the point where we have the data. It's gone through the system, and action is being taken to help these patients, to get them in, be that for an appointment, for a wellness visit, one way or another. We're taking action on these patients. We're actively making a difference because we're operationalizing that data that we've seen. And so this concept of a co-pilot that understands the context of what you're talking about, being able to, in this case, generate a list of patients that matches your criteria that you explained, is very applicable for a lot of different use cases, not only in kind of identifying the patient population you want, but what about the right report or the dashboard that you want? you want to take an action of reaching out to a patient, starting to actually turn those insights into actions. What does that workflow look like? Copilots to help with that. There's very, very broad applicability in assisting users with being more efficient so that they spend less time doing kind of back office administrative tasks and more time spent with patients, helping them to improve their care and really just improve the overall health of the population that they're managing.
So Mike, just to understand and clarify it for our audience, so just like ambient listening, this is like an AI assistant, right? For a physician or a nurse or a care manager that may not want to manually work those workflows, and instead typing in plain language enables the AI to pop up as an assistant and kind of handle the work, execute on the workflow for them.
Exactly right. Yeah, we can take kind of bits and pieces of that workflow, which maybe used to be a lot of paperwork or kind of thought work, and we can turn that into something where we're just allowing an AI to assist you and do a part of it for you. So if this was somebody's job and they can do twice as much of it, that means that we can then cover twice that percentage of patients that we're actually able to reach out to, make sure that they are, getting in for their appointments, making sure that they could be a medication adherence issue that we're pulling one way or another. We're fast tracking that point to where we can take action. And then with ambient listening and with the calling agents that are actually performing the outbound, we can also have the actual action itself, in many cases, not all,
Exactly.
taken by AI as well. If it's a data collection type of care management task where you're calling a patient, you're not cold calling, you're warm calling, but you have a human calling a patient to collect a data element, make sure that they are taking their meds, making sure that they, their weight hasn't jumped if they're CHF. There's a bunch of use cases, but that sort of data collection call it's a very resource intensive thing. We have a lot of humans spending time doing that, and when we have AI doing a portion of it, that means that those humans can have a much greater reach of the population. They can make a bigger impact on the health of the population.
Awesome. So again, just stepping back, big picture, you're really looking at 4 sets of value-added workflows, right? So starting with augmentation of current processes with traditional machine learning, deep learning, to prescriptive actioning, again, enabled by some of those technologies, to AI-enabled assistants such as this Copilot, and then eventually AI-powered automation of tasks, workflows, processes through agentic AI agents, right? I mean, that's kind of the spectrum of possibilities, which is enabled here. Awesome. Thank you for that short demo, which hopefully again lays out, provides visibility into some of this innovation that you and Evan have been leading at Lightbeam. My next question for you is, what are some of the innovative attributes and capabilities that AI modalities like Gen AI and agentic AI agents need to have to find more widespread adoption in healthcare by clinicians, nurses, executives, and caregivers, especially in the light of that MIT report we spoke about, right? So what will drive greater adoption and eventually, I think, ROI and value, right? Which is still not the case.
Right. Yeah. And again, I think we're kind of in the process of exiting the throw a bunch of stuff against a wall to see what sticks kind of phase of figuring out what we want to use AI for. We're finding good use cases where it does. I think there's a lot of historical thought around, AGI, right? And kind of being this general agent that can do everything. And I think what we've really found is that the more consistent use cases where Gen AI has been very, very helpful is less high level generic do everything and more very, very focused specific tasks. You're not gonna put an AI agent with the state of current technology in a seat where you had a human and expect it to do everything that human did. It's not there. AI is great at a lot of things. It's very myopic in its view of what it's doing at that time. And
Exactly.
so, kind of the understanding of the big picture, the way that us humans do, it's not there.
Yeah.
That's not where the technology is. So, but you have a lot of these administrative tasks where there's a very specific thing, and hundreds of them a day are done, thousands of them a day are done by some team of people. And so if you can take a large percentage of the of those repetitive tasks that can, a very focused agent can replace that task or assist a user with doing it at a multiples of the speed that they're used to doing it, then what you do is you reduce the overall workload at doing that task. And in the case of doing that for clinicians, what they don't have to spend time doing opens up, again, more time for them to spend time with patients.
Exactly.
Like the difference between talking to a patient in an annual wellness visit versus going and making sure that all of the codes made it into the to the EHR so that you get all of the reimbursement that you can. One is value add for like revenue purposes. It has to happen. The other one makes the patient's life better. The
Exactly.
more that we can make the patient's life better, that's really what we're trying to do, right? We want all of our clients, the clinicians that are using our software, to do as little as possible of the kind of administrative work that's been added over the course of the last couple decades, just more paperwork, and actually spend the time with patients, making their lives better, getting them
Of
the care,
course.
seeing more patients, just kind of really improving population health.
That is precise. That is, I think, completely aligned with the perspectives I've been hearing from a lot of our thought leaders in the healthcare industry, especially those who are either clinicians themselves or a CMO, CHIO, CDO, who are all former physicians themselves, right?
Right.
Concluding question, kind of a little bit of a personal question. Do you use and deploy AI platforms and tools in your personal life? And what are some of the most exciting platforms and apps that you have embraced? And can you talk about the value this has delivered in terms of higher efficiency and productivity for you as a technocrat, as a father, as a husband, right? And how is this making your life better?
Oh yeah, my when I'm having a discussion with my kids who are pretty young, that they started to use the nomenclature. Can we ask the robot? Which basically is it's chat GPT on voice mode is what that is. But yeah, I do absolutely in my personal life. My position and what I do at Lightbeam allows me the very fortunate opportunity to play a little bit. Like I get to figure out what's going to work and what we're going to roll out internally. So I get to kind of get my hands on a lot of different technologies to kind of see what's good, right? The throw it against the wall and see what sticks. I get to do a lot of that, which I really enjoy. As a technocrat, I'm more of a technocrat than a developer, but a nerd at heart, always have been. And so that kind of being able to play with the technologies and see what they can do, I love that. That definitely flips my switch. So I absolutely do. I mean, I've been a ChatGPT user for a long time. I have a lot of them. Recent one I've been playing with is Perplexity on
Mhm.
kind of doing research stuff. Really neat tool. But yeah, I mean the Claude, the Gemini, the ChatGPTs. I mean, there's a lot of tools out there. It's very interesting to try to find which ones have the strengths and the weaknesses and what those are to make make sure that we're picking the right tool for the job, whatever that job happens to be. So
Absolutely.
I absolutely do use it in my personal life, and I really enjoy being able to kind of keep my finger on the pulse of the AI market, play with the different tools as they come out, and kind of see. I'm really excited about what's to come. I mean, the rate of improvement of these technologies is nothing I've ever seen, and so I'm very optimistic and excited to see what's next.
Absolutely. And we share we share that passion, which is why we always have very compelling conversations in terms of the new tools
Absolutely,
and toys that we're trying. And the kids are prescient, by the way. They'll soon have a humanoid robot
I know.
they're running on it that they get to play with. So on that happy note, thank you, Mike, for this very engaging conversation. Thank you for all your insights. and for that showcase of some of our innovative capabilities. So that concludes this podcast. We welcome you to sign up for, enroll yourself, follow us on LinkedIn, check out our website, our blog, as well as a new LinkedIn newsletter, which provides summaries into all of these webinars and podcasts, as well as our thought leadership and what is coming. So thank you for your time and your attention today, and we'll see you in exactly a month from now with another exciting Voices of Value podcast. Mike, thank you again for your time. Appreciate it.
My pleasure, Andy. Thank you very much.